My name is Dr. Neil Baum, and I am the medical advisor for Vanguard Communications Group. I've been in practice in New Orleans for over 40 years, and I have built my practice around the concept of 4 pillars, and those are the patients already in your practice, the ability to attract new patients to your practice, your relationship with your colleagues, and number 4, having a highly motivated staff. I have a mission statement in my practice that has 2 concepts, and those are, 1, pay attention to the little things because they do indeed make a big difference. And the second is to make sure that every patient has a positive experience with the practice. We start that positive experience before the patient enters the practice, and that usually begins with the telephone. We make every effort to answer the telephone within 3 rings. We also want to make sure that the patient doesn't use a phone tree, but speaks to a human on that first phone call. The receptionist also directs the patient to our website and tells them that they can find information on their chief complaint. They are also informed that they should complete their demographic and insurance information and complete a health questionnaire prior to coming to the practice, as this will facilitate them being seen in the practice in the timely fashion. During the visit to the practice, we want to make the patient feel that the moment they open the door, they enter into our reception area and not a waiting room, because that is where we intend to receive our patients and make them feel comfortable and wanted, and make them feel that they are doing us a favor instead of the reverse. We make every effort to see the patient within 15 minutes of their designated appointment. We use a scribe, so I am not focused on the screen, but instead am eyeball to eyeball with the patient. The patient receives a 3x5 card, and they're told to write down any questions that they would like answered on that visit. They receive educational materials at the time that they are leaving related to their medical problem, and also they receive an FAQ form regarding any medications they receive. Patient is walked by myself or a medical assistant to the receptionist to check out. Even after the patient leaves the practice, we are very interested in interacting with that patient, and we start with an email to the patient thanking them for their visit and offering to be of any additional assistance that they may need after they leave the practice. We provide in that email an additional educational material, and also periodically we survey the patients using the free program called SurveyMonkey, and we respond to any compliments or suggestions a patient may have. We have found that this attitude of focusing on the patient and engaging the patient and making sure that they have a positive experience before they come to the practice, while they're in the practice, and even after they leave the practice, has resulted in satisfied patients, a staff that is satisfied and not overworked, and a doctor who is happy and productive and is home for dinner. I hope you found this few-minute video helpful and useful. If you have any comments or suggestions, please don't hesitate to reach out to me through my address at Vanguard Communications Group. Thank you.